Hey y'all, good morning. Remember, breathe, check for signs of dry cough, fever, 100.4, or shortness of breath. And then step back and let's start our day. Now, I normally talk to you and speak to you straight from the hip and try to define things, but this is very, very important. We're here in New Orleans, and you're hearing a lot on the news that we need to brace ourselves what's coming for the next week. Breathe, check your surroundings, call and check on your mom, check on your loved ones. Well, now let's step back and think about this. We know how to take care of ourselves, but a lot of us are caught in the fear or fight or flight response. But we know what to do. We know what to do. We know how to take care of ourselves. But just in case we need a little help, I've found exactly what the CDC tells you to do to take care of yourself. If you have tested positive, if you are sick, if you have a viral illness, on how to take care of yourself. And you can use this along with what your mom thinks, right? Now breathe and bear with me. 10 things to do. Number 1, we want you to stay home. Stay home so they can stay at work. Stay home so we can stop the virus from spreading. Remember, viruses don't spread viruses, people do. Number 2, we want you to monitor your symptoms carefully. Remember, breathe, check, step back, check for signs of dry cough, which is a cough with no phlegm or sputum being produced or cold coming up. This is really important. The virus attacks the respiratory cells and the little hair things called cilia that help move things out and protect your lungs from things like viruses and bacteria. It goes straight to the source. So I want you to try to take as much care of yourself as possible. Take your cough suppressants. I talked to Dr. Derry, my infectious disease specialist, and he said it's really important that Tussin, that Robitussin that your mom said, take it as directed and use cough drops, anything to suppress the cough. Because what happens is as you cough, you do more damage that causes more inflammation, that causes more fluid to potentially build up, and it could lead to a viral pneumonia. The viral pneumonia, which could lead you in the hospital and then needing oxygen supplementation and potentially hospitalization, potentially a ventilator. And we don't want that. Number 3, get rest. Get rest. If you feel tired, you're staying at home, get rest. Your body needs to rest and fight. Most importantly, though, we want you to get checked. Do these checks. Get fit. Eat healthy foods. And then get moving. Go outside and exercise, staying 6 feet apart, practicing social distancing. Number 4, if you have a medical appointment, call your healthcare provider ahead of time and let them know that you think you may have COVID-19. It's important. Everyone is looking through a COVID-19 lens, so that's important to let people know, even if you have to go to the emergency room, which leads to number 5. For medical emergencies, we want you to call 911 and dispatch personnel that you may or may not have COVID-19. That's for your protection and theirs. Now, medical emergencies include the normal medical emergencies. If you break your leg, if you feel like you're having a heart attack, but most importantly, if you, for our purposes right now, for COVID-19, if you feel like you're having difficulty breathing or your lips are turning blue or you're finding that you're confused. Number 6. Well, actually, they go even further. When to seek medical attention. If you develop emergency warning signs for COVID-19, get medical attention immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion or the inability to arouse or blue lips. I just wanted to re-emphasize that. We want you to cover your cough and sneezes, and of course, wash your hands as often as possible with soap and water for at least 20 seconds, or clean your hands with an alcohol-based sanitizer that contains at least 60% alcohol. Number 8, as much as possible, you want to stay in a specific room and away from other people in your house if you're sick. When I say if you're sick, I mean if you feel like you have a fever, if you feel like you have the flu, if you feel like you have any symptoms the aches, the chills that don't feel normal like you would normally feel sick. Number 9, avoid sharing personal items. That includes your thermometer. You want to clean everything you possibly can and sanitize as much as possible. I've been giving you the tools up to this point. And number 10, clean all surfaces that are touched often, like counters, tabletops, doorknobs, and use the household cleaning sprays. That's all 10 of them. I've listed them up top, but if you wanted to prepare a button and hear me say it, I did. Listen, there's a lot in New Orleans. They're going to be saying our name a lot. They're telling us to brace for this tsunami. Things are going to be rough for the next week. But I tell you what, we know how to take care of ourselves. I'll be here. You can call your mom, but we got this. Remember to use the self-checker. And on Monday, I'm going to post the review up to this point. If you have any questions, please tell me. And listen, it's okay to use the things in your tool bag. The World Health Organization retracted their statement about ibuprofen. Remember, we got this. No matter what you hear, stay home so our providers can stay at work. Check on them, call and check on them often. We got this. We got this. We got this.